Where bacteria have invaded the urothelium in chronic UTI and recurrent UTI patients, is it possible for this to resolve spontaneously via exfoliation due to the limited lifespan of the urothelial cells, which I understand to be around 200 days, at least in rodents?
Well, we used to think that that was a possibility, but we see it after pregnancy. That's the time. It's quite extraordinary that we deal an awful lot of pregnancy, because we get women coming in who have got fertility problems or recurrent miscarriage. We treat the urine infection, and before we've got the urine infection under control, they become pregnant without my permission. And as a result, we got to manage them for the infection throughout the pregnancy. And one of the characteristics of normal pregnancy is you shed epithelial cells like there's no tomorrow. And I think that they shed them so heavily that they get rid of the infection, because quite a few of them, the other side of the pregnancy, said, God, it's all gone. And some of these, we've had a real roller coaster ride. I mean, it's been a white knuckle ride for looking after their pregnancy. So I'm astonished. Now, the other thing that's perplexed me is given the turnover, the natural turnover, measured turnover of urothelium, why is it taking so long to get these patients better? Why? Well, we were convinced that the microbes had to have some kind of clever escape mechanism that was enabling them to reinfect new baby cells without attracting the attention of the immune system or the antibiotic attack. Now, if a microbe is not dividing, it can't be touched by an antibiotic. So if a single microbe comes out of a cell and starts swimming around, an antibiotic will not harm it in any way. But the immune system should identify it, and there should be immune reactants in the urine or white cells that will identify and deal with it. But we've discovered using confocal microscopy that these microbes are dressing themselves up in the urothelium. It's you know, it's like going backstage. They're all dressing up and they're covering themselves in ordinary urothelium, and then they leave the cell. And we know where they're going. They're going to find another cell. And the way they get into the other cell is by sticking their coat of urothelium onto that cell and then forming an intrusion into the cell. So we found a mechanism where the microbes can move from one cell to the other without being attacked by antibiotics and without being attacked by the immune system. So despite the fact that you're fighting at it with this constant shedding, that there's also mechanisms that are afoot that will sabotage that. So that probably accounts for why it takes such a long time. But I'm quite sure that there must be spontaneous resolutions somewhere out there. But of course, it's unlikely that we're going to see them in my practice, because we're at the last chance saloon. But I think that as people get more and more interested, and as primary care starts to collect the data that's necessary on urine infection, we're going to find all sorts of different stories in this.